Good evening. Happy New Year. Today, we are going to look at nervous system disease or some nervous system disorders. We will start with cerebrovascular disorders. Cerebrovascular disorders. Cerebrovascular disease refers to a group of these conditions that affect blood flow and blood vessels into the brain. Disease condition that affect the blood flow or the blood vessels into the brain. The problem that affect blood flow to the brain includes stenosis. Stenosis, that's when the blood vessels are narrowed. Another one is thrombosis. Thrombosis, when there is blood clot. This may include arteriosclerosis and arteriosclerosis. Arteriosclerosis, when there is fat deposit in the blood vessels. Arteriosclerosis, when the blood vessels are narrowed, is also known as stenosis. Artery blockage. This occurs as a result of a engulf oxygen in the blood vessels. Embolism. That's embolism. When there are engulf oxygen in the blood vessels. Hemorrhage. Hemorrhage can also occur. It can also cause cerebrovascular disorder. When there is severe loss of blood, this may occur as a result of accident. Another one is when there is this ischemia can lead to low oxygen and low blood supply to the brain. What are the causes? The causes of cerebrovascular accident or the causes of cerebrovascular disease. 1. Thrombosis. 2. Embolism. 3. Arteriosclerosis. 4. Hypertension. 5. Congenital. 6. Idiopathic. 7. Ischemia. What are the pathophysiology? The pathophysiology of cerebrovascular disease. The brain is constantly being perfused or supplied with oxygen and glucose. The brain is constantly being supplied with oxygen and glucose during active cognitive activities. Blood flow to the brain. This blood flow is affected when there is thrombosis, that is clotted blood in the blood vessels. Clotted blood along the blood vessels. This clotted blood prevents blood flow from reaching the brain, resulting to ischemia or deadness of the brain cells. Embolism can also block the flow of blood. Embolism, that is, air bubbles that occlude the blood pathway. Air bubbles that occlude the blood pathways. Another cause is stenosis, that is, the narrowing of the blood vessels. Stenosis, the narrowing of the blood vessels. When these blood vessels are narrowed, the flow of blood to the brain is restricted or impaired. The flow of blood to the brain is restricted or impaired, resulting to intracranial hypertension. Another one is obesity. When there is increased fat, the person is is having too much weight, more than the body mass index of the patient. The adipose tissues block the blood vessels up and prevent the flow of blood from reaching the brain. Another one is when there is ischemia. This may occur as a result of hemorrhage, severe bleeding, result to ischemia. This severe bleeding lead to loss of blood. When the blood is lost, small amount of glucose and oxygen reaches the brain. The clinical manifestations of cardiovascular cerebrovascular disease. We have vision problem. Example, blindness or double vision. The person may have myopic, short-sightedness. There is weakness or paralysis of the limb. Paralysis of the limb. He may have facial paralysis, either both face or one side of the face. Paralysis of the limb can be paraplegia, or that's one-sided paralysis, or quadriplegia, where all the limbs are paralyzed. Dizziness and vertigo. There is confusion, loss of coordination. There is weakness, loss of speech, loss of memory, loss of balance, and so on. Some of the predisposing factors of this disease include high blood pressure, atherosclerosis, high cholesterol, sickle cell anemia, and disorders, sickle cell anemia, and heart defects. Diagnostic investigation. Some of the diagnostic investigation include CT scan, MRI, Blood tests. The blood can be tested for erythrocyte sedimentation rate. Echocardiogram and history taking. The family history, taking of the family history is very important. Medical management. Thrombolysis. The one of the medical management is thrombolysis. This involves the use of a recombinant tissue plasminogen activator. This is given to subselected patients to increase the risk. Is given to some selected patients. This makes the blood to be in a liquid form. Even though this treatment may increase the risk of bleeding. Another one is aspirin therapy. Aspirin is given as thrombolytic agent. Heparin may be given, and carotid enterectomy and angioplasty. These are surgical procedures where the carotid artery is diverted. The carotid artery is divided into two. We have the internal carotid artery and the external carotid artery. The internal carotid artery supplies the internal structure of the skull. When either the external carotid artery is blocked or the internal carotid artery is blocked, the carotid artery is diverted with a tube to link it, to shun especially the blocked part of the artery. The nursing management. The nursing management includes assessment. Nursing assessment. During the acute phase, neurologic flow sheet is maintained to provide data about the following important measures of the patient clinical status. That is the change in level of consciousness, presence or absence of voluntary or involuntary movement of extremity. You have to assess the patient. You do motor assessment. You check the patient for eye opening. Check the patient for ability to speak. You assess patient for memory, perception, orientation, affect, emotions, sensation, and perceptions. Regular positioning of the patient is very important. The proper position of the patient help in blood flow. Proper positioning help in blood flow. It relieves pressure, attain a good body alignment. The patient should have a good body alignment whenever is sitting or lying on the bed. Prevent edema by elevating affected limb. Provide full range of motion 4 to 5 times a day to maintain joint ability. Provide full range of motion 4 to 5 times a day to maintain joint ability. Encourage exercise to prevent venous stasis, which can lead to thrombosis and embolism. Encourage personal hygiene. Analyze voiding pattern and offer urinal or bedpan. The patient may not be able to pass out urine by himself. He may be assisted with a bedpan or urinal. Frequently assess patient for signs of breakdown with emphasis on body areas and dependent body parts. Manage sensory difficulties by approaching patient with decreased field of vision. When the person cannot see very well, you can manage him for his sensory difficulties. Maybe you touch him to look at his response. Thank you for listening. You can make your comment and ask questions in my comment section. Like and subscribe my channel. Thank you.